What about those 3 to 4 individuals? So what do you do with those?
I think in most patient groups where the incidence is so low to begin with, giving them anticoagulation doesn't really change that. And although complications are relatively rare, I think that puts a patient in unnecessary risk because of the chance of benefit does not exceed very much because they already have a low risk to begin with. It's hard to lower a low risk.
Hard to lower a low risk. So, somebody asked me to be honest with myself. I mean, sometimes we have to say, I don't know when I don't know. We do not have clear benefit on the 3 to 4s, but I do argue many of those 3 to 4s that actually have to stay in the hospital, they're probably not a 3 to 4 anymore. I mean, they have acquired a complication. So the value is make sure that you rescore that patient.
That's right. So that's really very important. Is that those patients must be rescored because there always is the danger of those additional risk factors. And I don't see too many papers that use the risk score in a dynamic fashion, and that's a terrible mistake. In addition to that, relying on retrospective data where you don't know who asked the questions or if they asked all the questions is a really serious problem. And two special things about the Caprini score, which I think need to be re-emphasized. It's the only score that tracks obstetrical complications. Now, we need more data, but we know that some of those people with obstetrical complications later in life may still have a thrombophilia defect. And then family history of thrombosis. Very, very important to track family history of thrombosis in all 3 generations. And the latest data from Scandinavia in 750,000 patients pretty much shows us that we better take a look at that. Not just thrombophilia, because thrombophilia, only 30% of people with a DVT have a positive marker.
So I hear you. Family history as a great marker. Eduardo, hopefully these answers some of those questions next time you play with us. Take care.
All the best, Eduardo. Keep up your wonderful work.
Go ahead, your role.
Yeah, so